Hello, class. Welcome to Week 7, Healthcare Economics. My name is Mark Cantrell. I'll be your presenter this week. This week's topics, managed care. Now, I know it sounds crazy, but we've all experienced managed care. Most of the insurance in the country is under some sort of managed care program. Throughout this presentation, we're going to present the different types of managed care and what you should expect in services for managed care. So sit back and let's get started. What is managed care? The term managed care or managed health care is used in the United States to describe a group of activities intended to reduce the cost of providing for-profit health care and providing health insurance while improving the quality of care. In a nutshell, it was created to organize the healthcare providers into a group with physicians, hospitals, clinics, things like that, and the insurance company to improve quality and reduce overall costs. As you can see, it's been around a long time. Really went into effect for us mostly in the mid-80s, and it really wasn't affected a whole lot under the Affordable Care Act, otherwise known as Obamacare. With research, what I've found is that, we see more people in managed care programs that you may not even think, including Medicare and Medicaid patients. Working in a hospital, I see a lot of managed care patients. It definitely has its challenges, both in hospital and out of hospital, because with managed care patients, there's a lot of restrictions on where patients go for services, who provides those services, because their reimbursements all tied to those types of items. A managed care organization, by definition, is an organization that practices managed care principles. It's a health plan or health company which works to provide quality medical care at a cost-effective price. So again, everybody working to save money. The government wants you to save money. Who is this government agency? Well, that's CMS, Center for Managed Care Services. So they control reimbursement, and they contract out companies, various companies. In Florida, you have a ton: Humana, United Healthcare, WellCare, Optimum, Ultimate. I mean, you could go on and on. There's just so many different managed care providers, and I'm sure most of you have seen commercials on TV that have, said, we can give you. You see the older people riding off into the sunset, saying, "Spend your life enjoying it, and your money enjoying the beach, and all this while we take care of your health care at a reduced rate." It'd be nice if all of it worked that way. Managed care organizations fall into four main categories. Health maintenance organization, or HMO, which is controlled by usually one doctor who dictates the rest of the care throughout. Referrals have to be made through this primary care physician. A PPO, or preferred provider organization, which has a network of physicians. You don't need referrals for services, but you still have to stay. To get the best benefit, you have to stay in network. This is what most people have with their employer-based insurance. If you go out of network, usually costs you a lot more. Point of service plans, or IPAs, that's usually a primary care doctors that see the patients. They will form a group together. They're not really all together, but they tie services together. They're still independent, so they work together to provide care to reduce costs. And then an accountable care organization, ACO. And ACO is relatively new to the market. ACO is something that benefits, for the most part, both the patient and the government as far as reimbursement, because everybody's working to quality outcomes and reducing waste and improving preventative care, things like that. Let's talk first about the Health Maintenance Organization, or HMO. An HMO, as you can read in the slide here, has been around since the late 1800s. It was not until the 1950s that the government began to encourage the development of HMOs. In 1973, the HMO Act was passed, and in 1978, a Congress amendment increased federal aid for HMO development. So again, we're talking about the government getting involved, funding or supplementing insurance to make sure that we get this. Looking at the slide here, you can see that from 1980 to 1989, enrollment in HMOs increased from 9 million to 36 million Americans. By 1990, 95% of private insurance companies use some form of managed care. That's in the 1990s. That's when the government said, "Hey, we can do this. We're going to put our Medicare and Medicaid patients on this." That's again what we have. And as you can see up in the slide here, you can see HMO equals, in-network primary care physician. They've got to refer to a specialist, and then you can see them. It kind of is a drag. I mean, one of the big drawbacks on HMOs is that, again, you have to go through this primary care physician to get any other services done. He is what they call kind of the gatekeeper, because the reimbursement that is made, they're paying a contract rate to this primary care physician to be that gatekeeper, to control cost and to make sure that the patient is taken care of, in a manner that's going to be both cost effective and the outcomes are going to be the best. The Preferred Provider Organization, or PPO, like I said earlier, this is really what most employees have, or when I say employees, I mean employer provided plans have. You have a list of doctors that you can pick from, or clinics or hospitals, things like that. That's the provider, or the preferred provider solution for this. We all see this. It's like, oh, is my doctor in network? That's the question. Is always, is my doctor in network? Where do I find a doctor? And if we do that, they've negotiated a discounted rate in order for you to go there. Now, that doesn't mean you can't go somewhere else, because you can. It's just going to cost you more money. So the ideal behind it is, let's control it. We've negotiated these contracts with multiple people throughout the healthcare chain to provide the services that you need at a lower rate. So, making sure that your doctor obviously is in that network is great. Obviously, the drawback to this is, what if your doctor isn't in your network? Well, you're going to pay more. Bottom line. We saw that here in the area about 2 years ago. I work currently for HCA, which owns Bayonet Point Hospital and Oak Hill Hospital, and their insurance for employees is United Healthcare. United Healthcare, of course, is the insurance provider, or the PPO. A huge physician group in the area decided not to accept United Healthcare anymore. Well, that was a big blow to the area, because a lot of those people in that group, and it's a large group, and we'll get to that group a little later, covered a lot of people in the area. So a lot of people had to go switch and find different doctors, specialists, which is obviously the hardest to find. So it can have its ups and downs with that. You can pay out of pocket or pay a little more out of network to keep those doctors. And if they don't take the insurance at all, you're kind of stuck. So it makes it tough. So you can see in the chain there, you have you can go to, great part about this versus an HMO is you go to your doctor or specialist. You don't need a referral. Just need to take a look, make sure they're in network. You see all the doctors, clinics, whatever you need, they're in network. Again, you can go out of network, just going to cost you more. An IPA, which we discussed earlier, an IPA is doctors that want to still be independent. They don't want to join a big group, but they need the resources of other doctors, for things like managing payroll, supplies, things like that, accounting, billing. They can kind of share their services like that, but still retain their own practice. Pretty good idea. Many independent physicians, as you see up here, don't want to give up control by selling their practices to a hospital or large practice. Now, a lot of people have sold their practices and just became employees. But this is for those that don't want to do it, but they want to be part of a bigger organization. That's the key right there, is they want the benefit, and I apologize for my shaky highlighting there, but they want the benefit of being a part of that organization, bigger organization, because with that comes maybe cheaper costs, and they can farm out basically some of the stuff that they don't want to have to do, like payroll, billing, things like that. So it's not a bad gig for those guys. Here's the big one: the Accountable Care Organization, ACO. The ACOs are groups of doctors, hospitals, other healthcare providers like skilled nursing facilities, clinics, rehab therapy. All these people, their goal is, as you can see here, to provide high quality care. And that's the biggest thing I want you to emphasize here: high quality care to Medicare patients they serve. And they coordinate this throughout the process. So basically, you have a primary care physician who is going to say, okay, Dr. Joe, I'm Dr. Joe, patient Smith, we're going to take care of you from start to finish. You're a diabetic, we're going to coordinate all your, from medicines that we give you to visits to making sure that you're exercising properly, making sure you're with a dietitian. We're going to coordinate this whole care. Why? Because we want to make sure that you're taken care of wholeheartedly. We're looking for outcome, and we want to reduce this right here: avoiding unnecessary duplication of services. And I'm going to tell you guys, that right there is really big. How many times have you guys been to the hospital or to a clinic or whatever, and they've said, well, we need to run this test, and you say, well, I just had that done like, a week ago, or I just said, yeah, but my doctor, they want to see this. I see this all the time, or I see the lack of doing these tests. I'm going to tell you something. This is, it's all about saving healthcare dollars. Again, we talk about this. It's all about cutting costs, but providing the greatest service. Well, how do we get people to do that? It's about accountability. It's about saying, should we be providing this service for a patient in this manner, and is it going to cause the best outcome for the patient? That right there in itself is kind of a dilemma. A lot of people talked about this when they were talking about, passing the Affordable Care Act. They were talked about death panels, things like that, where somebody was going to decide whether you lived or died. I always kind of joke about it when I have an inter-team disciplinary meeting with our case managers and everything every week. That it's like, let's say we have patient XYZ, 85-year-old female with this. What say the panel? And you see this thumbs down mode. It's not like that, guys. It really isn't. It's about being studious and being accountable for the care that's provided. Are we going to are we going to provide all these tests and surgeries and things like that are not going to fix or improve the overall quality of life for the patients? And that's what it really comes down to. It's about making your organization the most effective and as lean as possible so that the patient benefits and the healthcare organization benefits from this. There's a huge ACO in the area, and that's what I've noted up here, Access Healthcare, and you guys may have seen signs or heard that. I can tell you that in Hernando County, Access has a huge footprint. They see, I would guess, between 60 and 75% of all the patients that visit Oak Hill Hospital. That's a huge deal. They basically have said, we're going to manage you. They have their own case managers in the hospital. They have their own doctors. They refer out their services when they're out of the hospital. Their decision making has a big impact on the patient and their overall care. So it's really important for them to coordinate care and make sure they get the best outcomes. It's, just to give you a little background with Access, a couple of years ago, Access, part of the deal with ACO is that if you do all this and you do it efficiently and you save, Medicare money, the government's going to give you some of that money back. Access actually received, I believe it was the second largest reimbursement in the country, right here in Spring Hill, Florida, of about $7.5 million back from the government for saving them money. So that's a pretty big deal. They've figured something out, and they're doing a pretty good job at it. The impact of managed care, like this comes back to quality, and you guys can see this. I want to show you, the overall health plan rating, and this was a survey for patient satisfaction, patient care, and what it impacts. You can see in 2014, the commercial HMO, how did they like the plan overall? Was 66%. The Medicare HMO during that time was 86%, and the Medicaid was 75%. So, again, it really depends on who's managing the care. The overall healthcare rating, meaning what did you think about the care you're receiving? Well, commercial HMO 78%, Medicare 85%, and Medicaid 72%. And then the ability to usually or always get needed care from the doctors and specialists over the past 12 months. Commercial 87, Medicare 87, and Medicaid 80. An ability to usually or always receive needed care or an appointment right away or as soon as care is needed. 85 for commercial, 86 for Medicare, and 80 for Medicaid. I'll tell you, notice that Medicaid is the lowest, and that's what you'll notice because Medicaid is primarily state-run. They take some federal government dollars, but it's primarily state-run. I can tell you that for us, the biggest problem in healthcare in our area is a lot of these Medicaid HMOs. They don't have a lot of outside benefits such as skilled nursing or home health care, things like that keep patients out of the hospital. So it really limits us in the hospital and in healthcare to being able to provide for the patient because of that. So insurance has a huge impact on the care that's provided. As bad as it sounds, it still does. So that's part of the managed care problem is, remember, the reimbursement's all tied to one payment usually. Somebody's receiving that payment and nobody wants to give up their part overall. So that's a big tweak that's got to be fixed if we're going to improve healthcare. So conclusion of managed care. Managed care has been successful in fulfilling its primary purpose of lowering healthcare costs in the United States, and statistics show drastic decreases in the use of inpatient care and accompanying overall reduction of cost. So we got less people being admitted, but is that a good thing? Many observers, however, would argue that the quality of care has suffered as a result. Well, are we keeping patients out of the hospital to save costs, when we maybe should have them in the hospital? That's kind of the problem with managed care. Another factor in decreased quality care involves conflicts in loyalty for healthcare providers. What's that mean? Well, on one hand, you want to do the best for the patient, but on the other hand, you want to kind of back off ordering tests or diagnostic tools, or rehabs, things that may benefit the patient because of cost. So it's that balancing act that we see. It's kind of like, do I do it? Will it really help the patient? Or do I not do that because it's going to cost more and that's less reimbursement? And that's where the big dilemma's been with managed care is, where's that balance? How do we fix that? What I'll tell you is this, from my experience, managed care has its place. I think we need more oversight in the sense that patients need to be more active in their care and an active participant in what they need. And I think that the oversight needs to be, are we actually doing all that we're supposed to be doing for the patient under that managed care contract? Is the outcomes going to be there? I think that if you do a great job in managing your patients and you do this, and that's what you're going to see coming in the future is pay for outcome, I think that you deserve to be paid more. when you produce those results. It's when you cut services and you make it look like, well, I saved the government money, but you didn't really improve the quality of life on the patient, that you need to be punished as well. Thank you guys for watching this presentation. Enjoy the rest of the program, and I hope everyone has a great day. Thanks.